So hello everyone. First, welcome to this press conference and introduce you to the guests, Mr. François Legault, the Premier of Quebec, Ms. Danielle McCann, the Minister of Health and Social Services, the National Director of Public Health, Dr. Horatio Arruda, and our two guests today, Ms. Sarah-Jeanne Labrosse, as well as Mr. Pierre-Luc Funk. Mr. Premier. Yes, hello everyone. We're first to tell you that the mask that I am wearing today was made by designer Nathan Kahn, somebody who inspires himself from drawings that are made by a group called Les Impatients, the Impatients, who give drawing classes to people who suffer from mental health, and a part of the profits goes towards mental health. So a beautiful project by Nathan Kahn. And I have a great visit today, special guest on top of the Minister of Health and the National Director of Public Health. I have with me today two artists with me, young artists, who have a lot of talent. First, Sarah-Jeanne Labrosse, whom you've seen, I'm sure, an excellent actor, as well as the moderator of Révolution, and the spokesperson for Tel Jeune. And that is important because we are in a period where it is even harder than usual for youth. So Sarah-Jeanne is the spokesperson. And we now have, I was seeing that, exchanges of conversations that are done not only over the phone, but by text messaging with people from Tel Jeune. So those who are a little embarrassed to perhaps talk over the phone can do it that way. And also, what's also good, the 10th or former 10th world tennis player. Oh, in the world? No, in Canada. Okay, not in the world. I would like that. Okay, I'm increasing the pressure here. Okay, and Pierre-Luc Funk, hello, whom I've always found amusing, but whom I've discovered as a dramatic actor in Fragile. Honestly, people who, if you haven't seen this, go see it. It's really good. And Pierre-Luc, together with Sarah-Jeanne, have been organizing for the past 2 years Mammouth. But this year, it's going to be the Mammouth Ball or prom, because unfortunately, a lot of young people who are finishing their secondary 5 won't have a prom. So they've decided to organize a virtual ball. So bravo, that is a really great initiative. And they are here today so that they can talk to you a little bit after I've finished. They're going to talk to you about the guidelines that have to be respected, amongst others, by young people. So I'm going to start with the numbers of the day. We have 85 deaths, a total of 4,069. I offer my condolences to all the families, loved ones of the victims. And also to tell you that out of those 85, there are 42 deaths that were older than 7 days, including people in Laval. So just to tell you that if we look at the past 24 hours, it's closer to 43 than 85. We have 47,987 confirmed cases, an increase of 573. There are, however, over 14,600 that are cured, 1,525 hospitalized people, a decrease of 10 compared to yesterday, and 169 people in intensive care. That is an increase of 9. One word on the tests. We've been talking about it for a long time, the importance of increasing the number of tests. So we were doing 6,000 tests per day, and our objective was to go up to 14,000 tests per day. Just to let you know that on Thursday and Friday of last week, we succeeded in having over 15,000 tests, both on Thursday and on Friday. So bravo to the entire team, Dr. Arruda's team, Danielle, who did that testing, took the samples, but also to Quebecers, particularly in Montreal, who accepted getting tested and who accepted our invitation. The challenge that we still have is that of the staff in CHSLDs. So it is important to say so. Right now we have a lot of people who came to help out who are not necessarily trained in health care. But just to let you know that together with Danielle McCann and the Minister of Education are going to be announcing to you over the next few weeks classes that are going to be set up for all those who accept getting training, and we're going to have short training sessions, 3 months or so, that should start around mid-June for all those who want to go work with those vulnerable people, including young people. Sometimes, we look at what we're looking to do in our lives. Well, it's something that gives a lot of value to work with people who are vulnerable in CHSLDs. Speaking of people who are in CHSLDs, I'd like to clarify something about the asylum seekers. First, to tell you how grateful we are to all those people who have gone to work in CHSLDs for the past 2.5 months, including asylum seekers. It has to be understood that asylum seekers are people who came into Canada, and the criteria to know whether they will be accepted as refugees or not is to know whether their safety, their physical safety, is endangered in their country. It's always been like that. It's still like that. However, I specifically asked the Minister of Immigration, so Simon Jolin Barrette, to look at the cases one by one to see whether we couldn't qualify them as immigrants, to be able to welcome them here, not as refugees, but as immigrants. So we are going to be analyzing every case. And of course, it is a way of saying thank you to them. I know that there's a lot of sectors left that are still not opened. Today's an important day in the Greater Montreal area. We are opening up businesses. I also wish to tell you that in the regions, so that is outside of the Greater Montreal area, we are going to be opening malls, shopping malls, as of the 1st of June, and Pierre Fitzgibbon is going to explain the details a little bit later this afternoon. As far as the other sectors, I know that I've been getting a lot of emails and messages from people who are asking, when is it going to be my case? When is going to be, my turn? I'm thinking about gyms and restaurants and camping, professional sports, hotels. I just want to say, we haven't forgotten you. We have a full list, and we have regular discussions together with public health to know when we can go gradually, because the idea is the same as before. We can't take the risk of having too much traffic in our hospitals. We have to spread it out over a certain amount of time. And perhaps a special word on cultural activities. I'm taking into, since we have artists with us today, I know that our artists are very creative, and I'm having a meeting this afternoon with Nathalie Roy, the Minister of Culture, and we're going to be announcing to you over the next few days programs to help people out financially, to help the production of art. And, things have told us, just common sense tells us that there are productions that are possible if the 2 meter is respected. Of course, it's a lot more difficult to be able to shoot love scenes, but there might be shows. We saw the 2 shows at Mother's Day, and we can see shows like Bonsoir, Bonsoir. And I trust, that the artists and the young people are going to be able to find a way to respect the guidelines, but to relaunch production. And I want to say that Quebecers are looking forward to seeing their artists again. And I think that it would do us all good and keep our spirits up. We'd like to do more rather than less in that aspect, so that all the productions that we are able to do with the new standards and guidelines that we have, that we are able to do it quickly. I'd like to end by my daily thanks to the young people today. It hasn't been easy over the past 10 or 11 weeks for young people. They've been patient And, sometimes we see a few exceptions, a few people who might not respect guidelines, but I see a lot of young people who respect the guidelines. And youth are our future, it's creativity, and I am convinced that we will be able to, over the next few weeks, to innovate and find ways of adapting ourselves and of bringing that new world forward. So I would now like to hand over the mic to two young people who are models, who are truly a source of pride for all Quebecers. A few words in English? I'm sorry? A few words in English? Oh, I wanted to say a few words in English first. Thank goodness she's here to remind me.
Good afternoon. I'm really happy to have two young actors with me today, Sarah-Jeanne Labrosse and Pierre-Luc Funk. I know it's been tough for young people over the last months. Our graduates from high school have been deprived from their bal, but Sarah-Jeanne and Pierre-Luc will host one on Télé-Québec on June 19. I want to thank them for this initiative. I also want to send a message to young Quebecers. If you want to take care of the most vulnerable, if you're looking for a rewarding job where you can make a real difference in people's lives, we could use your help in our help network. So I ask you to consider the training that will be announced soonly in the next few weeks. Today, I announce also that shopping malls outside the Montreal region will reopen on June the 1st. But if we want to continue reopening, we must stay disciplined. We must keep our distances and wear a mask in public. So I'm counting on you all. Thank you. Et sur ce,
and now I'm going to hand over the mic to Sarah-Jeanne Labrosse. Thank you very much, and thank you first of all for giving me this opportunity. It's really nice, and it's in choosing to do this job, just like Funk, we weren't expecting, like Pierre-Luc Funk, I call him Funk, but sorry. I think that we weren't expecting to end up here today, but at the same time, perhaps our words will have a greater scope than some others that perhaps, should have the same scope. But so I'm going to take this forum first to repeat to young people, bravo, and thank you. Seriously, you guys are so good. I put myself in your place, and I think I would have found it so hard. Whether it be secondary 1, 2, 3, 4, 5, it would have been difficult anyway for me to hear that I had to live the end of my school year confined, no more proximity with my friends and all that. So thank you for being so good, because you really are, seriously. Now we are here also to remind you that the guidelines have to continue being followed. And the more we go, the less we should find that difficult. We shouldn't resist. We shouldn't fight it. We have to try to decrease the chances as much as possible of spreading that virus. And we don't know. I don't know. You don't know whether we have it. So the question of being asymptomatic for a week, it's possible that I have it. It's possible that you have it. We really have to be careful, because we know what the serious consequences this virus can have on a person or a family. So we're here to just repeat that the 2-meter distance is important. You can see your friends. The measures have changed, the rules have changed. There is a way of having a certain social life, and that, makes us feel good while respecting the number of people and the distance and all that. But put on your mask. It's really, really a way of not spreading the virus. So please, I trust you. I'm saying it. I know that you're going to do it. Put on a mask when you are in an uncontrolled area, when there's people around you. That is showing that you are nice and that you're taking care of your community, of your society. It's being brilliant, it's being responsible, it's being cool. Any synonym for cool that you find. So I trust you. 2 meters, don't get together with others, and very soon we'll be able to high-five one another, and I look forward to that. And I give my mic to my friend. Well, listen, I so agree with everything that you just said, Sarah-Jeanne. And yes, we are here to talk to young people, because, in fact, we're talking here about everyone right now, but young people, it's important right now, because they are experiencing an important part of their lives, in the sense that they are becoming more dependent, that they are freeing up from, what they were and becoming who they want to be for the future. They're deciding what kind of adults they want to become tomorrow. And right now they're asked to be confined. And it's hard for them, but they're with us, they're fighting with us. And in fact, we're just here to remind you that the more beautiful the weather is and we want to get together in our parks, we can, as long as we keep the 2 meters away. But let's not forget to take every single measure. That is, wearing the mask, holding onto the 2 meters. It's true that when you don't feel that you have symptoms, you don't think as much about the consequences, but those consequences can be serious for other people. So it's important, even if we feel good, it's okay if you have a slightly moist face. If you have a mask on your face, it's the least of consequences to protect others around us, and it's important to protect us, to protect others that way with the 2 meters. So the more we work together, the quicker we go back to the normal life we used to have. Thank you very much for your message. A word in English? No. We are now going to go to the question period. First, the question period in French.
Également vous en tenir à une question sans sous-question, s'il vous plaît.
Bonjour, Annie Guillemette.
Hello.
Mr.
Premier, your counterpart in Ottawa this morning said that there were discussions going on right now with every province, so I imagine with yours as well, about giving 10 paid sick leave to workers. They were thinking about the month of October with the return of the flu season and runny noses. First of all, I'd like to know where are we at with those discussions and how we can frame it, because it's going to be very expensive and companies don't have the solidity right now to be able to pay that. Well, yes, in fact, we are at the very beginning of the discussions with the federal government. We have to see who would pay for those days off. In certain cases, the companies that already have financial difficulties, it would be difficult to ask them to pay for those days. But even in the labor organization, that has certain challenges for certain companies. So we really are at the very beginning phases of the discussions. It's only just taking place. We are still analyzing the impacts, and we ourselves, we're also talking about it with companies.
Bonjour, Monsieur Legault. Sébastien Desrosiers de Radio-Canada. Écoutez, il va faire chaud.
It's going to be really hot this week. Quebec could experience one of the earliest hot periods of its history. They're saying 32 in Montreal tomorrow, and most of the rooms in CHSLDs in the provinces don't have air conditioning. It's between 25 and 33%, I think. How can we make sure that the elderly in CHSLDs will not suffer from this heat wave on top of the health crisis? Well, what we had done since the beginning, when we arrived a year and a half, we had a special budget. It was about $30 million or so to have air-conditioned zones where, zones where there's more fresh air. And of course, we had not thought at the time that there would be COVID-19. So right now, there is 97% of CHSLDs that have these zones with more fresh air. However, that presupposes in certain cases taking residents who are in their rooms and bringing them to these cooler zones. We know that one of the objectives that we had given ourselves, but is going to require a certain number of years, is to replace the HSLDs by elderly homes where each room would be bigger and air-conditioned. But we can't do that from one day to the next, building these homes. We are going to start doing it this fall. There's already about 10 projects that have been announced. But right now we're working, first of all, to make sure that it be 100% of CHSLDs that at least have a zone, a cooler zone, to be able to bring together the residents when there are extreme heat days, when there's scorchers, maybe 4 or 5, 6 days in the summer. So to make sure that we are ready to face it. But honestly, there's still work to be done on that front. Just as an add-on in the short term, Right now, we're being stuck with a heat wave in the month of May. It doesn't happen very often, but we do have a plan that was supposed to deploy itself in the month of June to even add additional air conditioning units, and we're going to accelerate that and start earlier. It's because we have a lot of obsolete buildings that can't take, electrically speaking, they get overwhelmed. But there are external units that exist through the window that we could position in certain CHSLGs, as many as possible, of course. So we are putting forward that plan in an accelerated way to, of course, be able to respond to this heat wave situation that we're going to be experiencing. We're going to be doing this in the short term. Just to rebound on that question, because I think that it's important to understand that the elderly home for the elderly is coming, and there's been a budget planned for it, but now in the next few days we're going to be in the middle of it. I know that we're trying for solutions. This is something that we didn't see coming, but there are people who are writing to me, and I'm taking an example here. Somebody who wrote me, my mother, who is 68, is confined in her room because of COVID, and the guideline of the staff is to not have ventilators work. I know that they're still waiting for public health to know whether because of the ventilation system, they're scared that it's going to spread. But now the heat wave is coming. Are we thinking of, for example, taking hotels? That could be done, perhaps, to put people in a place where they could have a break from the heat, because those people are worried, and they're right to be. It could be 30, 35 degrees in a room already with what they're experiencing. It's not going to be easy, if you'll allow me. During the day, a guideline is going to be sent to all the managers of the CIS and CIUS establishments to make sure that patients do not suffer from the heat. As such, we know that there was a notice from the Institute, I saw it, that there are certain ways of doing things, that, you can't send the air in people's faces, in case there were droplets, but it's clear that we're going to do it. We do have that plan. And independently of COVID-19, we had that plan. We are going to accentuate it. And locally, not that I want to eliminate reasons, but we're going to make sure, even with external generators and mechanisms of ventilation made with specialized films, to be able to, even in a situation where we don't have enough electricity, to have individual air conditioning units to be able to cool down the rooms. And of course, clearly our worry of having, the perverse effects of the heat wave, dehydration, we want to take that into consideration even beyond COVID-19. Be sure that we're doing everything that is possible, and dependently on the capacity and the local evaluation that is going to be done, well, other alternatives could, in fact, be set up to make sure that people, the elderly, do not suffer too much from the heat over the next few days and this summer. I would still like to take this opportunity to thank our young artists who are amongst us. I have to say that you're doing a job that I would love to have done. I won't keep it from you, but we don't all have the same opportunity in life. Well, it's still time. No, I'm just teasing you. But art is so important. I want to thank you for your creativity, for taking care of youth, because I love youth people. I feel like them, even though I'm an old guy. But, a message by an old guy is never as, important, or never is as significant as the one from a peer. So I thank you. And I want to remind everybody with a young heart, even old people, we see a lot of people in parks, and it's okay. It's okay that people be able to get together, that they get out of their houses. But when we tell you to respect the guidelines of social distancing, of wearing the mask, of washing your hands, I know I'm rambling, but it's major if we want to give back to youth and our society the ability of not having to take that step back. The effects of what we're doing right now are only going to appear in about 2 weeks. So we're deconfining. We have we feel a wind of freedom, but it's like a conditional freedom. And I wish to thank you and thank all young people. I understand the impact that it has of not having your prom. I wouldn't have liked that, not having a prom. But I hope that we'll be able to give you things that are more important than that, and I count on you to listen to our young, beautiful, intelligent, creative spokespeople, as you all are. And I know that we can all trust one another, and I also invite the adults to do the way that the young people do it, because sometimes we get suggestions, from young people about the behavior of others. So thank you for being here with us, and continue carrying that message out to others. You are exceptional. Thank you.
Bonjour, Dominique Scali du Journal de Montréal. On entend de plus en plus parler
We hear more and more of people who are into conspiracy theories, people who go to unreliable information sites. Could that stop the respect of guidelines? Is it something that concerns you? Yes, it's something that worries me. I'm always surprised to see in the surveys the very high percentage of people who believe in conspiracies. Of course, I feel like handing the ball back to you. We need you, the journalist, to give truth and facts. But we are in a society where, I don't know, we could have great theories, but is replacing religion now? I don't know. But it's always surprising, in fact, to see people get into these conspiracies. Do you feel like adding something to that? Well, I don't think that it's a conspiracy. I don't know what else I can say. And yes, it is hurtful when people go down that way, that road. Well, I don't think that we would want to create a conspiracy to end up in this situation. It always exists when we talk about, vaccine. There's always a part of the population that tries to say those things, but there are reference sites that are reliable. And places like Radio-Canada, and different media, they tell stories, of things that are invented that become epidemic in a subsection of people. But it's important to go to a reliable source of information because it's too easy to manipulate people within these perspectives.
Bonjour, M. Legault, Pierre Saint-Arnaud de la presse canadienne. Monsieur Legault et Madame...
Mr. Legault or Ms. McCann, I'd like to come back to a question that I had asked you at the beginning. I know that to remove the omerta, you made an email address that seems to be working pretty well, Ms. McCann. The question that I had asked you, however, has to do with another threshold, which is the one that you were talking about, having people that can have information that is verified and credible. That is based on the fact that the bans of people to talk to the media are still ongoing. There are confidentiality clauses, even memos that have been sent where it's specifically written, to not talk to the media. Are we able, Mr. Legault and Ms. McCann, to ensure amnesty to people who do speak to us? Is it possible to suspend these clauses in question? And would it be possible as well to suspend temporarily Article 7 of Act 97 that protects whistleblowers but does not protect them when they face the media? Well, that is the exercise that I talked to you about. I remember the last time that we are reviewing all of these confidentiality agreements in what is planned in the different laws or different articles of different acts. So that is ongoing. I think that it has to be done rigorously. And really, I want to tell you that the first, the objective is to be able to fix things. We want to know what's going on because we want to fix the situation. So whether people talk to their manager, because it also happens a lot in establishments and facilities. There are places where communication is relatively good. But taking into account that we are in a situation that is very complex and complicated, and that there have been years where there's been an organizational culture that did not privilege communication from the bottom up, well, we have to act. And that's what I'm interested in. What I'm interested in is that people are free to talk because I know that the solutions are a lot at the base with those people who intervene and with the managers in the field. That is why we had over 2,000 emails. And I'm telling, the managers to whom I speak regularly, the CEOs, well, there has to be I'm listening to you, je vous écoute, in each establishment, and that's what we're going toward. Without saying that it's going to be like that everywhere, it's unequal, and we are experiencing a very complex situation, so we are changing an organizational culture, and that requires a certain amount of time, but we are acting, and everything that we're doing right now, as I always say, we do in 2 weeks what we would have done in 2 years. So now we're doing it as quickly as possible, and we're going to free up people to talk. And people who talk to the media, it's very often because they have had no other recourse. So what we're interested in is that there are other recourses to be able to fix problems as quickly as possible. Now, if they haven't had a response in all the recourses that they have, including je vous écoute, well, then I can understand that they want to talk to the media. It's just that right now they don't have the right to do it. Yes, I understand that. That's why we are reviewing all these confidentiality agreements. and we are going to get back to you with that once we'll have reviewed that entire file, which is not simple, but we really want to get to a good place with that. And probably in the fall, we'd like to have a very profound change in the organizational culture of our establishments. I have nothing to add, except since the beginning, what I said to everybody is to be 100% transparent, to not hide anything. Sometimes it's not the information that we would wish to see, it's not the results that we would wish to see, but we are trying to be transparent. So, of course, there are negotiations going on right now, so it's not always simple, the discussions with the unions, but we have nothing to hide. Even the offers that we've made to the unions, the president of the Treasury Board made them public. So...
Bonjour, Kathleen Lévesque.
Hello, Kathleen Lévesque, La Presse. I wanted to talk to you about money. Like last week, but this time we remember that the RTM had filed a recovery plan at the request of the government at the very beginning of the month of May. There are 16 projects, over $9 billion attached to these projects. Are there choices that have been made up until now, and if so, which ones? Well, it's not completed. The analysis is ongoing right now by François Legault on transportation. But remember that we took commitments before the electoral campaign. We want a tramway that will go from the east of Montreal to come downtown. We want a tramway or a REM from east to west in Laval. We want 2 on the South Shore, 1 on Boulevard Taschereau, and 1 that will be further east-west. And there are also projects that have already been launched, whether it be from Montreal toward Laval or whether it be the Blue Line. So that is ongoing. Now the RTM has arrived with other projects. Honestly, it's a question of prioritizing. The message that I sent out to people is that I don't want there to be one construction worker that is not working in the next few months and even for the next few years, because it's going to be hard in certain sectors to recreate jobs. But in infrastructures, we have a lot of work to be done here. It's just a question of knowing what the priorities are going to be. And there's also debates going on between the request of what we call the 514, so Montreal, and those of the 450 area. Because sometimes when we talk to 514 or 450, the priorities are not quite the same. So it is up to us to decide, but we are in that analytical process. But you wish to open up these construction sites as of the end of the summer? Or because when we talk about quickly, what are we talking about? Well, as quickly as possible. You know that the RAM construction is already reopened. We must, together with François Bonnardel and the president of the Treasury Board, we have to accelerate that. That's what we announced. $3 billion in projects that we're going to be accelerating, especially in 3 sectors, so transportation, schools, elderly homes. So as quickly as possible, and I'm going to give you some news. There's going to be a bill that we're going to have approved by the opposition parties to accelerate certain steps, the preliminary steps to construction. So I hope having the collaboration of all 3 opposition parties. You're referring to the recommendation of the RTM? That's one of the things included in it.
City News, Montreal.
English?
Premier Legault, with the target of 14,000 tests having been reached, what can we expect for testing in the next few weeks now that thousands have returned back to work today and people have started gathering? Are you planning on ramping up even more?
But first, I would like to do more. Would like to go to 16,000, even 20,000 eventually. But we need to have first people that are ready to be tested. That's clear. We want also to focus on certain area where we have more cases. And I'm happy. And I repeat again, if we divide by the population per million of residents, Quebec is testing a lot more than Ontario, United States, France, Germany, UK, Italy. So I think we're doing a lot already, but I want to do even more, and we're working on that. But can we be happy that we reached the target of 14,000?
Next question.
Matthew Lapierre with the Gazette. Dr. Arruda, Quebec is still reporting hundreds of new cases every day. Do we know where these new cases are coming from? Do we know how the virus is still propagating?
In fact, we should understand that we also had a new program of testing healthcare workers and everybody in different CHSLDs and houses for elderly people. In those testings, we are finding people who are asymptomatic, which are cases. So this is a part. Even if we test more people, the cases are going down, but not really the one in transmission from case to case. It's probably asymptomatic people who are testing, or I would say asymptomatic contacts of cases. There are some small outbreaks going down in schools, but not a lot. So I think that it's normal. More we're going to test, more we're going to find asymptomatic cases, which is a good thing because, in fact, those asymptomatic cases will, I hope so, stay with the profile of disease. And so what is going to be very important is to follow up hospitalizations and people who die from the disease. And for the moment, even here in the Montreal region, even in the high-risk places, the situation is getting better. But it's very important why we want the people respect the distanciation, because we don't want to see another source of transmission which will be outside between people groups because they didn't respect the 2 meters or had been too much crowd in even outside can be transmitting the disease.
And I can add that over 573 new cases, there were about 500 coming from the Greater Montreal.
Thank you. Next question.
Anthony Nerestan from CBC. I would like to get back to what my colleague mentioned about the zone de climatisation, the cooling zones in long-term care homes. What can you tell us about how these homes are equipped to bring people to those cooling zones, but also maintain a physical distance? Because you have some people that are COVID positive, they can't stay in their room all day in the heat, so you have to bring them to those cooling zones. What can you tell us about how ready those homes are to do that while not contributing to the spread of the virus within those homes?
Yes, it's going to be some gymnastic, I don't know if it's a good expression in English, but it's going to be more complicated this year. And we're going to have to be very careful not to have, people mix, as you're saying, COVID-19 and people who don't have the COVID-19. But we know what to do. And there's going to be different alternatives. Will it be that we're going to have a room for people who have COVID-19 and with a certain space, and another room for people who don't have it, and also the corridors have to be very protected? Or are we going to have more equipment, like we were talking about with Génératrice, those equipment that you can add to a building and through the window, and you can climatiser a room? We'll probably go with that also, depending of the situation. We're talking about regions where the heat is greater, like Montreal and the Greater Montreal, obviously. So we're working on that already, and we want it to be in place completely in the best delay possible. I mean, of course, the 3 days we're going to live, we're going to do our best, but of course we want it for the summer, for the heat of the summer.
Thanks. Next question.
Hi, Giuseppe Valiente, the Canadian Press. I think this first one is for Dr. Arruda. So over the few days we're seeing the government's testing more and yet getting fewer and fewer confirmed cases of the virus. That's the opposite of what you assumed was going to happen. So I want to ask you, over the past, you mentioned Thursday and Friday, there were high numbers of tests. Do you have the stats for Saturday, Sunday? And can you explain why we're seeing this phenomenon of more testing, fewer cases? And for Mr. Legault, can you please explain what gives you confidence that as Montreal retail opens up and over the next few weeks, Montreal's healthcare system can support a possible increase in cases and hospitalizations?
First of all, I think that first there is a transmission in high zones which are going down because people have been exposed and the disease before. And one thing is, and what is great to see, is that the hospitalization and death rate is going down. It means what happens 2 weeks ago. What is going on actually will be appearing about 2 weeks from now. We had test more, it's true, and with testing we find out cases also, but the cases we find comparing to the level we did before are, the one is going down, this one is going up, staying at the same level. And it's normal that when we test more and more asymptomatic people, when we test more and more other population, the level of positivity of tests is going to be down. When we decided to test people coming back from traveling, we had a high level of people getting infected. Almost 16-17% of the tests were positive. When we did it in CHSL days, in healthcare and in around the cases, we were also at a 17-18%. When we begin to test a little bit outside of those settings, there's going to be people not infected that are going to be tested more than when we go to a specific category. So it's explained these numbers, but it's only with time that we will be able to do that. Another thing which is very important is testing, and we will try to get up. I won't say any date because I don't want the Prime Minister, the Premier, it's the name I should say in English, the Premier to tell me how come you don't have been to this. We're going to have what we call the seroepidemiology studies. That will make us to understand how many people in Quebec have been infected with the virus since January. Is it 5%, 6, 7, 18? And that is done by, we call it a sample, a statistical sample of the population, and then we're going to have a better idea of all those numbers. If you were asking me, we had on the 21st of May 16,273 cases of tests, 15,687 on the 22. 23 was 11,763. It's a little bit lower. It's the weekend. That's almost like this. Probably that the numbers of yesterday, Sunday, are going to be also lower, and probably Monday it's going to getting up.
Thank you. Next question here.
Maybe to answer your question, when you look at the last 7 days in the Greater Montreal, we had 114 people less in our hospitals for the COVID-19. So we're now at 1,194. So it's still tight, it's still fragile, and that's why we are reopening gradually. That's why also we're saying today we have to continue being careful, because we cannot afford to have large increases in the next few days or weeks in the number of people in our hospitals in Montreal. So far it's going down. I'm happy. Of course, this week will be a key week because we're opening today the retail business. So we'll have to follow in the next few days how the situation is evolving.
And just to clarify, Mr. Arruda, you said serological testing is going to be starting in Quebec. It hasn't started yet, but you will be doing it?
There is some tests done by EMA Quebec on samplings of things, but there's going to be a study which will be planned. It's going to be planned in Quebec, but also in collaboration with other provinces. It's supposed to get into process in the month of June. hope as soon as possible. We're making a lot of pressure for that beginning soon.
And in terms of the hospital beds, we're also starting the regular activities, also in surgery. People are waiting, have been waiting for a long time, so we need to keep the situation stable and even decreasing in terms of the COVID-19. And that's why I thank also Pierre-Luc and Sarah-Jeanne to help us with this, because if people, not only the youth, but also everybody keeps those behaviors of the 2 meters and the mask and washing your hands, it's going to have a direct impact on the hospital beds. Thank you for that, and that's why we want the situation to become better or be stable.
Thanks. Next question.
Hey, Dan Spector from Global News. Mr. Legault, I was curious why you seem to have changed your mind about the whole asylum seekers thing that you spoke about at the beginning of the press conference.
Okay. I haven't changed my mind. What I say is that we have 2 different matters. The asylum seekers, we have to be careful. I don't want to send a message that in the future we will accept everybody if they find a job in Quebec. That's the situation. But we also have another situation where it's really critical to get more people working in our CHSLD. So those people, they are already working in CHSLD. So how can we bring them via the normal immigration process? That's what I'm looking. Of course, we'll have to have discussion also with the federal government. But they won't be as asylum seekers, because asylum seekers, in order to be accepted, they have to prove that their physical situation is in danger in their country. That's a different story.
Next question.
Good afternoon, Amanda Klein with CTV. Given the fact that Premier Doug Ford over the weekend was encouraging everybody to get tested, symptoms or not, why isn't Quebec doing the same when Quebec has more cases and more deaths in the province?
First, to be fair, we're doing a lot more tests in Quebec than in Ontario. And I think we have to first focus on people having symptoms first. But after you've tested as many as you can with symptoms, then you can concentrate on people without symptoms. Maybe they are at this stage in Ontario, but I can tell you that with 15,000 tests a day, we're doing a lot more than in Ontario.
And just to clarify, because as you mentioned yourself, Mr. Legault, this week is crucial because of businesses opening in Montreal. Can you remind people what the criteria is when it comes to who we can hang out with, where, how far apart you need to be? Just because I think there is some confusion if it's from the same family, if it's 10 people.
Okay.
It's just so that everybody's on the same page.
Okay, what we say is that you can be a group of a maximum of 10 outside. We would like that these 10 people, that they come from no more than 3 different families, all right? That's a kind of suggestion, because when we discuss that with the police representatives, it's not easy for them. It's easy to say, are they less or more than 10? That's easy. Are they coming from more or less than 3 different families? The application is tougher. But what I'm asking people is to be careful and try to be limited to people living in 3 different houses. And when you meet, you have to meet outside. You have to stay at 2 meters, wear a mask. So far, we're not talking about meetings inside. We'll come to that, but we have to go gradually. I want to make sure that we keep the control over the number of people in our hospitals. So that's why we're going gradually.
Mr. the Premier, if I can add, I will strongly recommend it. I would say why. Because when you are in contact with 10 persons coming from 10 different families, your statistically risk of getting is more higher than if you are in contact with 3 families. You know, the ones on the same family can be together even less than 2 meters because they are there at home. But it's 3 groups of 3 kinds of exposition. But if you get 10 different families, it means that there is more risk that one of those has no symptoms and transmit it. It's why we're going with this, we call it the bubble of families, or it's because of this. And I understand that sometimes it could be 4 because there is somebody living only. But the more you are in contact with different people, with different histories, who don't know, it's not because they are symptomatic, they are probably, they even don't know they are sick. But the more you expose yourself. And it's why we're beginning with that principle. And nobody is going to be checking you if you are 4 families between 3. But really, don't forget that each time you meet somebody, you don't know if he is infected. And so it's going to be 10 different stories of life than if a family which will almost be exposed to the same people. It's why.
S'il n'y a pas d'autres questions, c'est ce qui met fin au
There are no further questions. This is the end of the press conference. Thank you very much, Sarah Jeanne, and to Pierre-Luc. Thank you so much. Have a good day, everyone.